Hi there. I want to teach you how to use bitter leaf to cure malaria. When we were younger, the common medicine for curing malaria were Chloroquine, Nivaquine, Camoqiune, and what have you. By the way, quinine has to do with things that are bitter. Over time, they developed products that are called ACT, and those products were effective at the time. Malaria is the only sickness I suffer. By the way, if mosquito doesn't bite you, you will never suffer malaria. But recent time I noticed that after taking malaria tablets, in no time, maybe 1 month sometimes, 2 weeks sometimes or less, the malaria will come back again. And I'll be like, what do I do? How do I use natural herbs to treat malaria? So this time around, malaria came again. And I asked one of my children in the church to wash bitter leaf for me to drink. Of course, you know that before you squeeze it, you have to wash it as I'm washing it now. So she washed some for me. It was in the evening. I drank one in the night. The next day, I drank one in the morning. But it finished. And it wasn't possible for me to squeeze and continue to drink. I resorted to eating it raw. Like this. I ate a certain quantity in the morning, a certain quantity in the evening for 3 days. And the malaria was gone. But somehow, I traveled to Lagos and mosquito bit me anyhow. So I had malaria again. And treated it in half measure. Half measure because I didn't use it the normal 2 times and 3 days. I just took small and stopped. And unfortunately, the malaria came back with full force. You know, when you take a drug, there's something that's called drug resistance. If you treat a particular case in half measures, for you to be able to cure yourself, you have to treat it with stronger medicine than the first one you used, because you've abused the drug usage and the drug had started resisting. So that was what I experienced. But then, because I wanted to be certain that bitter leaf can cure malaria very well, I decided not to take any other medication but bitter leaf. This is the way you're going to squeeze it. But along the line, I started feeling cold. So I had to leave the chapel that one fateful day and went to a clinic and asked them to give me paracetamol, because in the night the cold caught me so much, but I managed it. The next day again, it was catching me. So when I got to the clinic to ask them for for paracetamol, they said, sure, you use native, why are you coming for English drug? I told them, well, I know that garlic and ginger can cure cold, but I don't have it at the moment. I already have taken something to take care of the malaria, but for the cold, I need paracetamol. After a long while, the doctor asked them to give me paracetamol. They gave me paracetamol, and I started using the paracetamol to take care of the cold. When that one finished, I bought another one, and eventually went to hospital. When I got to hospital, they suggested to do malaria test, typhoid test, and blood test to know whether I have enough blood or less blood. So I insisted that I only want to do typhoid malaria test. I don't want to do typhoid, I don't want to do blood. So eventually I had my way. They took my blood, excuse me, and tested it. After a long while, the lab technologist called me and said, "Did you say you took drugs for malaria?" I said, "Well, I didn't take drugs, so to say, but I took something for the cure of malaria." She said what she's saying is because the test proves that malaria is negative. Meanwhile, when I first had the treatment, I told you my elderly friend that was there with me had malaria and treated with malaria too. Then another baby, another member, a child, small girl had malaria, and the same bitter leaf was used for the treatment of the malaria. So at that point, I was convinced that bitter leaf could treat malaria. Meanwhile, that my friend too had case to go to hospital and also went for test, but malaria wasn't positive, it was negative. So after the test, and I confirmed that malaria was negative, I became well off all of a sudden. You know, psychology, when things are disturbing psychologically, you will not know how to help yourself. So, but as soon as I was certain that the malaria was negative, I became well. Even I stopped drinking the paracetamol again, and as I speak with you, I am very, very all right now. So, friends, this is how you will squeeze the bitter leaf after washing it to wash out the dirt, because it's something that you're going to drink. Of course, I've shown you how you can eat this one raw, even if you don't have time to squeeze this one. Let me squeeze this one as well, because I preserved it again to show you. Of course, I've eaten it before now. So when you squeeze it very well, add a measure of water. You don't need to add plenty water, because if you add plenty water, it will not be bitter enough. Actually, I prefer eating it raw, because in eating it raw, you eat all the bitterness and have more effect. But if you still prefer to squeeze and drink, that's okay. So having squeezed it like this, of course, you know that this leaf too, after squeezing it, one can use it and cook a bitter leaf soup, or add it in any other soup. You now add water.